Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractic Posture and Wellness Clinic. This video is about retrolisthesis. If you know that word, you've got the problem, so stay tuned. All right, let's talk about retrolisthesis. There's a video I've done about, in general, what's called spondylolisthesis. So the vertebrae either move forward or back or move backward. How did I say it? Either the vertebra goes forward compared to the rest or backward compared to the rest. So that's what spondylolisthesis is. This video is about retro, meaning backward listhesis. So I drew a picture here. It doesn't matter, you can have retrolisthesis in any part of your spine. Typically, it's in the lumbar, in the lower back, or the neck. So let's just say if this is the back part, this is the front, back and front. So we're just looking at the configuration of the vertebra over top of the other one. So typically, they need to be stacked on top of each other, following a curve. In retrolisthesis, there is not a slippage, but that's the word they use, the shifting of a vertebra towards the back portion of the body. There are different degrees of it. So based on how many, and what we do is we go 1, 2, 3, 4. Like if there's a line in here, we divide it into 4, and then we can see how much of it has gone backwards. So if I follow this, that looks like that's about second degree, that type of situation. But that's the technical, you've got spondylolisthesis, you want to know what to do about it. So that's what spondylolisthesis is. Typically, it's as a result of not necessarily injury. More people are born with it. They just don't realize it until later on when they've got the problem. And then we x-ray and say, well, you've got retrolisthesis. With retrolisthesis comes instability, which makes sense. The vertebra's not where it should be, it's somewhere else. So there is instability around each vertebra, and in retrolisthesis, that is not there. So what I want to discuss with you is what are some of the things you can do. A lot of times what ends up happening is, let's say in the lumbar spine, since you can see my lumbar, my lower back, let's say that vertebra is moved backward. So a lot of times what is typically said is start doing abdominal crunches as if that's gonna pull this vertebra that's backward, gliding it forward. For one, I'm 100% against isolating a muscle and work it out, because you're never an isolated muscle. You're a collection of muscles that work together. So look at it like a concert. Even in a concert, when the spotlight is on the pianist, there's still the background musicians that are playing it. So your body parts have to do and know what their role is, while other parts are doing a little extra. So when you're doing isolating and doing this abdominal crunches on the ground, let's say, you're really not doing yourself a favor. You really are creating a lot of issues. More than anything, you've got to focus on proper breathing, and proper breathing isn't putting your hand here and making your tummy come out. I don't know who came up with that, but I guess that's better than nothing. That's a biological breathing. If you don't know what that is, we're going to make sure at the end of this video, we put that video I did on just that. There's really, now you may be wondering, well, geez, now I need to learn how to breathe. The answer is yes. Who knows what that breathing is? Very simple. We go back to the basic. Proper breathing is what babies do at birth and continue doing until they jack themselves up by going to school or playing one-sided sport. So if we go back, we'll see all the babies on this planet breathe the same way, unless there are issues like diseases or genetic disorders that compromises that. Same is true with movements. You never see a baby do oblique muscles of the abdomen or transverse abdominis muscles doing these. What you see is the baby moves and tilts from one side to another side. That's how you develop that, as the spotlight is on the oblique muscles. All the background music, all the other parts of the body are supporting that portion of the body. So did I answer your question? I think I answered your question by saying don't isolate and exercise the muscle. Go through the series of what's referred to as developmental kinesiology, principles like dynamic neuromuscular stabilization, or DNS. If you don't know anything about it, check out my website. I've totally explained this to you so you can better understand. But someone had messaged me asking me to do a video on retrolisthesis. I hope that I answer that. If you're isolating a muscle and trying to somehow move this muscle forward, this bone forward, that ain't gonna happen. So don't waste your time. Is this a surgical case? No, not necessarily. Most of them are actually pretty subtle, most retrolisthesis. So my suggestion is do postural neurology, do developmental kinesiology like DNS, and those are the exercises that will strengthen and proper breathing, that will strengthen your barrel and put this at a much, much better, more stable position. I hope you learned something from this. Make sure you subscribe to the channel. And if you have any questions, ask me those questions. Send me an email and call the office. Take care.